Hello everyone, welcome back to the session 4 of week 5 of NPTEL course in herbal drug technology. We are doing herb drug interactions and we'll see few more case studies. So if you recollect, in the previous session we saw herb drug interactions with particularly hypericum and ginseng. In this particular session we will see 3 additional herbs which are a preliminary study or which are a preliminary target of interactions seen globally, and this include your black pepper, which is commonly used as condiment and spice, ginkgo, which is used for cognition, and licorice, which is used as a sweetening agent. So let's see these interactions. So if you recollect, the interactions that happened could broadly be classified as pharmacokinetic interactions, which had to deal with absorption, distribution, metabolism and excretion, as well as pharmacodynamic interaction, which dealt with the effects that the drug produces on the body, and the overall interactions lead to what is called as addition, synergism, potentiation, antagonism and also adverse effects in some cases. Now coming to our first herb today, that is your black pepper. Now this is a common herb we see in almost every household in India, and those are the fruits of Piper nigrum, which have been kind of removed, dried and treated. Not only are black pepper, from black pepper you get white pepper, which is nothing but just peeled off version of black pepper. So the interaction that you see with black pepper will be the very much same interactions that you see with your white pepper as well. Now this black pepper is synonymously called as pipli, kali miri, or even for the trade sake it was called as black gold. Now why are we classifying this as drugs? Because this is definitely a food, but if you see traditional system of medicine, especially Ayurveda, Ayurveda treats black pepper as well as long pepper as herb. So if you see your applications, you will have it as spice, definitely as seasonings, but majority as an Ayurvedic medicine, where it is prescribed in Ayurveda for treatment of cough, cold, dyspnea, throat disorders, intermittent fever, in some cases stomach ailments such as stomach ache, dysentery, worms or even piles. So these are few treatments that is mostly for cough and gut is where your Ayurveda prescribes your black pepper from. In addition to that, black pepper is also known to be a source of antioxidant rich phytochemicals with anti-inflammatory properties. Not only that, the warmth, that is the spiciness of it, which is attributed to a compound piperine, also acts as a GI stimulant, thereby aid or helping in digestion, and it's also a carminative. Now coming to the phytochemicals present in this plant, like I said, the major warmth of the black pepper, the pungency of the black pepper is because of this beautiful molecule, which is an alkaloidal compound called as piperine, which is present in a very high concentration, that is almost 5 to 9%. Now this is not a solitary alkaloid present, there are almost 50 more alkaloids reported in your black pepper which have almost similar kind of structure. This include your piperolin 1, that is piperolin A and B, then you have your piperonolanin, that is you have your piperonolanin, then you have your pipershamencimide like your pipershamencimide B and C, then you have your cinemoyl piperidine, then you have your piperin or cumaprin, then you have your achelimide, then you had your piperidine. There are numerous other, like long chain, whereby the chain length changes herein. such kind of alkaloids are present. You have your dihydropipernolalin, then you have your tricholine, you have your piperylin, and you have your bradykinin B or pipernigramides, especially your pipernigramides A to G are few compounds which are alkaloidal in nature, not mentioning all the 50, but these are the major ones. Apart from it, if you take your black pepper, it has a beautiful aroma. The aroma is attributed principally to beta caryophyllene, but in addition to that, you have your careins, limonins, pinene, as well as saponin. You have your antioxidant compounds, which are your flavonoids, quercetin and myricetin. Now when you go to Ayurveda, like I said, the black pepper is used in Ayurveda for numerous therapeutic benefits, and it is the Ayurveda which actually found out the potential of black pepper as a bioenhancer. So a chief pharmacokinetic property of black pepper, it is when you consume anything with black pepper, definitely its content is enhanced in our body, and that is what is referred to as bioenhancer. So Ayurvedic practitioners observed this. They prepared a mixture of 3 herbs, especially 3 astringent pungent herbs, that is your black pepper, long pepper and ginger. It was seen that this combination, when given with other herbs like your adulsa, which is used to treat cough, increase the gastrointestinal flow, enhance the GI blood flow due to the warmth, the feeling and the pungency of it, and overall the efficacy of this other Ayurvedic medicines improved. So this bioenhancer properties were discovered clinically as early as 1929. So from there on, numerous other mechanisms also have been found out in addition to improving gastrointestinal blood flow. This includes bile secretion. So whenever you consume a lipid rich meal, our liver secretes a juice called as bile acids. Now this bile acids which are secreted when you consume something lipophilic is enhanced when you consume black pepper. So when you consume black pepper, the bile acid secretion, which is responsible for emulsification, absorption and increasing the solubility of lipophilic compounds happens. Now imagine you have a lipophilic drug, definitely it will get solubilized, it will get emulsified, and all in all its blood concentration will be improved because of this bioavailability enhancement. Not only that, if you take the GI lining, it is said that consumption of black pepper, especially piperine, improves the brush border which is there on the intestine, membrane fluidity, as well as those tiny microvilli which are responsible for absorption of nutrients. The length increases. So imagine like this is the lining and these are your tiny microvilli. Now when the length of microvilli increases, what is going to happen? The overall surface area also increases and absorption is also going to increase with that. Not only that, even if you take or talk about the transporters like your gamma glutamyl transpeptidase, it is enhanced, and as a result you have increased absorption of amino acids. Now in addition to that, it also enhances at cellular level DNA receptor binding, the signal transductions, inhibition of efflux. We saw that efflux threw back. Now imagine if that pump are inhibited, it will be building up. Efflux was something, once the drug is absorbed, we saw in the previous session, it kind of threw back. Now if this pump is inhibited, the drug concentration will go on increasing in the cell. Not only that, in addition to phase 1, it also inhibits phase 2, which is your functionalization kind of metabolism. Numerous other pathways by which your piperine acts as bioenhancer includes CYP inhibition. You remember this drug? Inactive. And this inactivation was done by CYP. Inhibition of that will increase your drug. So it inhibits CYP3A4, which was responsible for 50% of the marketed formulations metabolism, especially the drug candidate CYP2C9 and CYP2E1. Now, in addition to that, inhibits P-glycoproteins, it inhibits glucuronidation, which is involved in the phase 2 transformation, especially of curcumin. It was seen that now, because it is not metabolized by UGT, what we call it as glucuronyl transferase, what is going to happen is your curcumin is not going to get functionalized, curcumin is not going to get polar, and hence curcumin is not going to get excreted. So then if it is not going to get excreted, there is no breakdown of curcumin, and definitely the bioavailability of curcumin is maintained to as high as 2000% as compared to the non-piperine analogues, and hence your black pepper is often given in combination with your turmeric. Now, if you are talking about allopathic drugs, it was found out that it increases bioavailability. Now, we have seen so many mechanisms by which piperine acts as bioenhancer. Now, hence it will act as bioenhancer for phenytoin, midazolam, propranolol, carbamazepine, theophylline, and then what happens is this concentration will go on increasing. Now, this concentration increases means that you have to take a lesser quantity of drug when you are administering it with black pepper. But one case it was seen in clinical trial of carbamazepine is if you are taking very high doses of black pepper, black pepper is very pungent, spicy we call it. If you take a very higher content of black pepper, that leads to GI irritation, and if GI irritation happens, that causes peristaltic movement, and that leads to removal of whatever we have consumed, and then this increase in gastrointestinal motility will decrease again the plasma level. So you have to see that you consume black pepper, but up to a appropriate level. Not only that, if you see in terms of absorption, drugs such as anti-allergic fexofenadine almost two-fold rise in concentration when observed in the rats was seen when consumed with your black pepper or piperine. Now, coming to pharmacodynamic interactions are not so prevalent in black pepper. However, two important interactions which should be known is black pepper somehow is known to give you or manage your blood sugar levels. So, it was seen not in human trials but in rabbits combining piperine with anti-diabetic drugs such as repaglidine as well as sitagliptin produces synergy as well as additive effect. Now, what is synergy and additive effect? Synergy is more than what is advised. So, if I am taking sugar and if I am taking diabetic medicines, if I know my concentrations will be half, and if I take another drug which gives you the same effect, that is my concentration is going to be half of it. Now, both of them when taken together, if it is going on a very negative side, that means it's kind of giving you a synergy. So, you have to be very careful with anti-diabetic medicines if you are consuming black pepper. Similarly, a little bit of piperine is also known to slow the blood clotting, and as a result, if you are taking anticoagulant medicines, especially warfarin or antiplatelet like your aspirin, you need to be careful there because there is a risk of bleeding when combined with these medications. Now, moving on to our next drug. The next drug is a drug which is taken for again CNS disorders, and that's your Ginkgo biloba. Now, Ginkgo biloba, it belongs to a Ginkgoaceae family. The leaves of these plants are taken as supplements, and in market you will get leaf powder everywhere. Now, Ginkgo extracts as well as capsules as well as leaf powders have been used so many places. This includes CNS like management of anxiety, management of stress in elderly population, especially those who are at the risk of dementia, those who are showing symptoms such as Alzheimer's, where cognitive functions are decreasing, where you have your memory functions which are decreasing, where the blood flow to the brain is decreasing because of aging. In such cases, ginkgo is considered to be very, very beneficial. Not only that, for people those who are on medications, especially for schizophrenia, it is said that the side effects of these medications can be managed if you are taking ginkgo supplements. Not only that, it improves symptoms of vertigo in patients suffering from depression, and again is beneficial for patients those who are suffering from migraine and headache. So most of the CNS ailment it takes care of owing to its antioxidant effects, rejuvenating effects, increasing the blood flow, and that's where your ginkgo is used. Now this is attributed to the compounds present in ginkgo, and those basically the active ones are two classes. One which are called as terpenoids. This include your ginkgolides. So you can see here they are typically 5-membered pentacyclic moieties, as well as bilobalides, and bilobalide are actually thought to be degradation products of ginkgolide with one ring less. Okay. So here you have your ginkgolides and bilobalides. Your ginkgolides are again subclassified depending upon their substitution as A, B, C, D, J, M, as well as bilobalides. Now in addition to it, it's a very flavonoid rich extract or composition. So you have your quercetin, camphorol, isoramnitin, rhamnitin, you have your ginketin, you have your bilobetin, you have your cediopsitin, you have your cediopsitin, as well as isoginkettin. So all of these flavonoids kind of contribute to the antioxidant potential as well as the enhanced blood flow to the brain. Now in terms of its interactions, if you see ginkgo is again a CYP inhibitor, but not clearly 3,4-A or very strong 3,4-A as compared to your previous examples that we've seen, such as hypericum, which was very potent 3,4-A inhibitor. This one is little weaker one. So this targets two CYP enzymes, that is CYP3,4-A in a mild manner, which is responsible for metabolizing heart ailment conditions, drugs such as your nifedipine, which is your blockers, as well as if you take this along with nifedipine, it is said that it can give you a little headache, dizziness, and in some cases hot flashes. Now again, another drug which is metabolized by CYP is an anti-diabetic drug called as tolbutamide. So again, what is going to happen, the tolbutamide concentration in your blood is going to increase, thereby leading to hypoglycemia. Similarly, warfarin is something which is metabolized or which is also metabolized by CYP2C9, and hence again its increased concentration will put you at increased risk of bleeding. And there have been few patient reports also where people have turned up in the hospital where they have co-administered warfarin, ginkgo, and shown symptoms of bleeding. Now coming to the pharmacodynamic interactions, mostly this is because of the antiplatelet effect. So if you have a drug or if you are taking blood thinners like your aspirin, or a drug which has a like antiplatelet activity like your clopidogrel, in that case you are increasing the risk of bleeding in that patient. Similarly, it is seen that other drugs, the side effect of which is blood thinning, say for example selective serotonin reuptake inhibitors, we saw these drugs have a little side effect, and that includes your blood thinning. So your fluoxetine or sertraline, or even when you take your serotonin non-adrenaline reuptake inhibitors such as your duloxetine or venlafaxine. So in that case also, again you are increasing the risk of bleeding and severe hemorrhage in the patient. So you need to be very careful while giving this medications, especially if the patient is taking ginkgo. Or if you are taking this medications, you are not advised to take ginkgo, or take ginkgo only after a particular advice from a physician about the dosages. Now in addition to that, ginkgo, because of its stimulant properties on brain, as it increases circulation, increase stimulant, it interacts with antidepressant drugs, especially your tricyclic antidepressants like amitriptyline. In that case, what is happening, it will lower the seizure threshold, and as a result the patient has increased chances or incidences of seizure. Now moving to the next drug. The next drug is a drug which is consumed in Ayurveda for its cough properties on a, like a demulcent, or in the properties as an antitussive, as well as it is consumed in the Middle East countries as a confectionery and as a sweetener. So this drug is nothing but your licorice. The spelling of it differs in your English and British. So you have your QUORIC in British as well as CORIC in American. The both spellings are correct. So these are fresh, peel, unpeeled or even dried roots and stolons, which are obtained from Glycyrrhiza glabra, Glycyrrhiza urulens, inflata. They are all Leguminaceae or Fabaceae family members. Now this is a herb which is used in Ayurveda, which is used in different traditional system of medicine, mostly for your disorders pertaining to inflammation, that is your gastric duodenal ulcers, inflammation of bronchus, that is your bronchitis, pharyngitis, inflammation of liver, that is your chronic hepatitis. Now it has, you to be very careful, adenocorticosteroid or adenocortical hormone like effects. So you need to be careful, anti-inflammatory, antibacterial, antiviral, and also known to exhibit little anti-tumor effects. Now it shows, because it shows cortisol or cortisol like effects, because it shows cortisol like effect, it can be used in Addison's disease, where normally the adrenal glands are not producing enough amount of cortisol and to help retain the sodium. Not only that, it is used as a sweetening agent and a flavor enhancer for tobacco. Now the compounds of it are classified as again saponins and non-saponins. The major component of this is saponins. So if you see the saponin, the main component is glycyrrhizin. So whenever you take licorice powder and boil it in water, you see copious foam, and that is due to the presence of glycyrrhizin. Now this glycyrrhizin is present about 6 to 10% and it's very sweet. So it is almost 30 to 50 times sweeter than sugar. And what happens is, in gut it is converted into a glycone, that is your glyceritic acid, also referred to as your enoxolone. So this enoxolone exhibits the mineralocorticoid like activity. Apart from it, the antioxidant, anti-inflammatory effects are due to flavonoids, isoflavones and chalcones. So you have your licoritin, isolicoritin, glabridin, which is nowadays also used as a fairness enhancer, and licochalcones, especially licochalcones A, B, C. Now in terms of interactions, pharmacokinetic interactions, there are numerous reports in literature where studies have been done in mice or in rats, where it was found that it definitely kind of interacts with CYP3A4 or CYP3A4 or even 5, CYP2C9, which we just saw, CYP2D6 and CYP1A2. But when all of this was studied clinically in actual patient, no pharmacokinetic or no significant pharmacokinetic alterations as were seen. So in terms of standardized extracts of Glycyrrhiza glabra administered to healthy volunteers, no alterations of CYP enzyme, especially induction or inhibition, were observed to a level of significance. But yes, there are papers which are reported in mice, there are papers which are reported on in vitro basis. In terms of pharmacodynamic interactions, however, we need to be very careful. First thing, the reason is licorice in itself causes hypokalemia. Hypokalemia is loss of excessive potassium from the body. Now, it causes retention of sodium. If sodium is retained, it is retained at the expense of potassium, and as a result the potassium is lost. Now, this potassium is also lost when you take diuretic drugs. Now, this loop diuretic drugs also causes potassium depletion. So, imagine licorice plus your diuretic both are causing potassium depletion and sodium retention, and that might cause adverse effects. Now, there are also drugs which depend on sodium potassium ATPase, and example of that is digitoxin. If you do not have potassium in your body and licorice is removing potassium, the consumption of medications, especially the heart medications such as digitoxin, may be fatal or even cause untoward effects. Now, this in addition to its cortisol like effect. So, cortisol is generally secreted by adrenal glands and is vital for maintenance of blood pressure. But imagine licorice kind of enhancing it, you will have more than elevated amount of your cortisol, and that will lead to an higher blood pressure. Now, imagine a patient whose blood pressure is already elevated, who is feasting on licorice candies, and then what is going to happen is the blood pressure is going to increase further. Now, if you take any antihypertensive medicines, the effectiveness of this antihypertensive medicines is not, like your nifedipine or amlodipine. It won't work really well because your licorice is increasing the BP. So, first you need to take off the licorice supplements from that patient and then give you BP management medicines. Now, your licorice also contains isoflavones. Now, these isoflavones are thought to be estrogen mimetic. Now, this estrogen mimetic activities normally are not seen, but especially in women, those who have PCOS or PCOD, these effects are much enhanced, and you need to be very careful while consuming medications for treatment of this ailments, that this mimetic action may somehow decrease the efficacy of medications, especially for the PCOD or PCOS. Okay. So, here are a few more references if you wish to know about the interactions of licorice, ginkgo as well as your black pepper, and thank you everyone for your patient listening.